Hi there, I'm Simon King and I want to welcome you to the proprioception.org.uk website. This is a website about proprioception, which most people would understand as body position sense, but it's so much more than that. And this website is the observations of 10 years in practice where I have looked at proprioception and how it alters healthcare in general. And if you understand how proprioception and muscle tone relates to healthcare, it changes everything. Every health discipline has components of it, of proprioception. In fact, proprioception is essential for human function. And if you understand proprioception, you can understand why some people get better with a certain treatment and why others don't. Why some people break every bone in their body and make a full recovery, and other people bend over and pick up the shopping and never get better. The answer is not that the trauma to them was different. The outside factors weren't different. The answer is that their body was unable to handle the forces that were put on it. So it's an internal problem, not an external problem. And this website is a collection of observations and theories that explain why some people get better with treatment and others don't. Because, of course, we all know that's the case. It's just that medicine ignores the internal differences in people totally. In fact, medical science is designed to ignore those factors so that an individual case is never regarded as valid in medicine. It's only the collective. It's only when you have an average of a group of people that science says that a treatment is effective. Well, that's just ridiculous. You can't say that having an example of one successful treatment which we know we can't apply to everybody is invalid, and then say, well, when we average all the results we get one treatment, that then we can apply that to everybody and that's a scientific treatment. And obviously there's a lot of people that fall out of that system as when that treatment is ineffective for them. Anyway, we'll leave the science for now. We'll go back to observations of how bodies actually work and how you can make them work better, whether you're a health practitioner or even just as a patient for yourself, your own knowledge and information. Now, to understand proprioception, we have to understand three basic reflexes. Those reflexes are the myotatic reflex, the flexor withdrawal reflex, and the law of reciprocal inhibition. Now, you'll find my explanation of all of those reflexes in this site, along with a lot of other information. And once you understand how those reflexes control muscle tone, you will know how important muscle tone is to preventing injury and illness. And if you then take that factual information about how reflexes work and then just extrapolate and watch the examples that I'll show you on this website, you will see that we make the most fundamental of errors in trying to change our body but not influence these reflexes. We never consider that these reflexes might be important. For instance, the withdrawal reflex. When we step on a nail, we know that reflexes from our skin draw our foot off the nail. And we would be incredibly either incredibly stressed, like in a war situation where we would run with the nail in our foot, but as soon as we could, we would stop and take that nail out of our foot and get rid of the irritation to our skin. We know that. We would do it instinctively, we would do it all the time. We know that if we touch something hot, we pull our fingers away from the hot iron. And we know that even if we get tickled, we withdraw from an irritation. So if we know that we would take a nail out of our foot, why do we leave a nail in our ear with an earring? Why do we leave a nail in our ear? Why do we leave a nail in our belly, as in a belly button piercing? And you will see examples on this website where I've removed piercings from people and their whole health is recovered. They have normal function and their injuries go away. And so I wanted to invite you to explore this totally different way of thinking about healthcare. And you can incorporate this into your own life, into your own health, or into the people that you treat. Along with these examples that you can use on yourself, there is a whole 6 hours of seminars that I did a couple of years ago. It's completely free. You can go through all of these concepts in great detail and learn how to find these problems and how to fix them by removing foreign bodies in or on the body that affect our muscle tone. From there, you can go on to another set of seminars that are a paid set of seminars where practitioners can learn how to identify different types of toxicity and nutritional information that can help them help people understand metabolism, because taste and smell and all of those other senses also influence muscle tone. And so we're going to look at how that can happen, how you can use that to help your patients. And finally, there's another 6 hours of seminars that are applicable to chiropractors and osteopaths and physiotherapists that teach you how to use this in a physical modality way, how to use this information to improve the results of your patients, and especially those patients that don't respond to normal chiropractic, osteopathic, physiotherapy and exercise care. There are reasons that people don't respond to care, and if you know how to find those reasons, suddenly practice becomes so much more fulfilling. You can solve problems that have been previously insurmountable and do it quickly and easily. So that's the brief summary. There's lots of information on this website. Please feel free to delve into it, watch the examples, lots of videos, and just one thing to do, sign up for a free membership, and I'll be able to keep in touch with you about further information and developments as they happen. So welcome along, and hope to see you very soon.